Are there female-specific health challenges? In today's episode, we answer 3 key questions. What are female-specific sleep disorders? How can women navigate sleep challenges at different stages of life? When should women reach out to an expert for sleep disorders? Dr. N.Ramakrishnan is a healthcare entrepreneur who is American board certified in internal medicine, critical care medicine, and sleep medicine. He has a master's degree in medical management from University of Southern California. He is currently the director of critical care services at Apollo Hospitals, Chennai, and is a senior consultant in critical care and sleep medicine. He was the first board-certified sleep specialist to practice in India and established Nithra Institute of Sleep Sciences in 2004. He was also invited to meet the then Honourable President of India, Dr.A.P.J Abdul Kalam, who appreciated his contributions in the field of critical care and sleep medicine. Let's get started.
Hey everyone, I'm Deepa, light functional medicine practitioner, author and yogini, and you're listening to the Sleep Whisperer podcast, the only sleep podcast with conversations and meditations. I'm on a mission to share profoundly insightful sleep conversations with global visionaries that merge together functional medicine and ancient wisdom. Breathe in bliss through weekly guided meditations and let yourself enter the land of dreams. Together, let's unravel the pieces, get to the roots, and understand the right tools to transform your sleep completely. Through this podcast, I want you to dream the best version of yourself. It's time to regain hope and begin your sleep journey.
Dr. Ramakrishnan, welcome back once again to the podcast. Last time we spoke about male-specific sleep disorders. Today we are talking about female-specific sleep disorders. And I loved the previous episode because you also explained why men are more predisposed towards those specific sleep challenges. Similarly, I would like us to explore the female-specific ones as well. So maybe you could start us off with, if you'd like, again, a quick overview of all sleep disorders, or if you want to just go directly into female specific, we can look at that.
Thank you once again for inviting me. And I think I will start with a very brief overview on the sleep disorders. Just in case the women don't want to listen to the sleep disorders in men, I think I still want them to understand what are the common sleep problems. So number one is what we call insomnia, where they have trouble sleeping, particularly if it is not triggered and if it is lasting for 2 or more weeks. It is called insomnia and it may need to be addressed. Number two is those with excessive sleepiness during the daytime, or what we call daytime hypersomnolence, which could be related to a problem called sleep apnea, which is the most common one causing daytime sleepiness. But remember that anybody who doesn't sleep adequately will also feel sleepy during the daytime. So that could also lead to daytime hypersomnolence. Number three is what we call fragmented sleep pattern, where they try to go to bed, but they're restless throughout the night and keep waking up, tossing and turning. And that could also be, like what we lead to daytime not feeling fresh, and they feel that their sleep is not good. And there are some very specific female-related disorders where we'll talk about in this. Fourth is a group of what we call circadian rhythm disturbances, where we are not sleeping on time, we are not waking up on time, and that could be jet lag. It could be related to age, and we will talk very briefly about it in some women as well. And lastly, what we call REM behavioral disorders, where something abnormal happens during sleep. I did mention about a specific one for men, but there are some that are more specific in women, which we will also talk about.
So can we just start off with what are these female-specific sleep challenges?
Sure. So number one, as I mentioned, is insomnia. And there is a very nice song in Tamil, which says that try and sleep your best right now because you're never going to get good sleep as you grow up. Now, I'm just putting it in a very straightforward way, but very beautifully written poem. And so there, I think they hit the nail on the bed because it's like really that's what happens to women as we grow. And insomnia or lack of sleep is very common when like different phases of the women's life. For example, during menstrual periods, during the premenstrual cycle, a lot of women experience disturbances in sleep. In fact, some of them feel that's the way that they're getting alerted to the fact that they're going to get a menstrual period. That's extremely common. Um, During pregnancy, particularly, like during the second trimester and more, as the uterus grows bigger and they have other issues, that's also a time when they develop a lot of sleep related problems or insomnia. During menopause, once again, due to this huge hormonal changes, they can develop insomnia or disturbed sleep. So I think insomnia is very common in women at different stages of life. In fact, science says that women actually require maybe 20 minutes more sleep than men, but most women don't get it. And there are a lot of surveys that have clearly shown that 60% or more women say that they do not get adequate sleep. So insomnia is an extremely common problem in women.
And in fact, doctor, before you go into the other ones, I must share that I have a very close friend and whose sister would always talk about not sleeping enough. So she had an elderly father-in-law, husband, and two sons. And she would say every single night she would not get to bed till midnight or post. And she'd be up again by 5 a.m. because she felt she had so much to do. So I think you are so right when you shared that quote in the beginning. And sadly, this friend's sister suddenly one day was diagnosed with cancer and she passed away within a month of diagnosis. So it was very alarming that I really have been encouraging my friend to prioritize sleep ever since that happened.
Absolutely. Yeah. The second group we talked about was, like the daytime hypersomnolence or, not feeling fresh in the morning. Again, here for women, unlike men, where we talked a lot about sleep apnea, here the commonest reason for them not to feel fresh during the daytime is because they're not getting adequate sleep during the night. Okay, just imagine one night if you don't get sleep, the next night morning you wake up with a headache, you feel irritable, you cannot focus, you feel sleepy during the daytime. And if women experience a reduced sleep for a long period, they accumulate what we call a sleep debt. And therefore, they feel chronically tired, chronically fatigued. Sometimes they even start developing psychosomatic symptoms related to that, saying my body is aching. And then they keep, going around different, specialists, sometimes find something that may not really answer it. Like they say, oh, I've got thyroid problem. And then you go and treat that, but that doesn't answer all of these. So if they're having all this daytime fatigue, and before I forget, I also want to mention, we talked about sleep apnea in men who are snoring. In women, it can happen after their menopause. They are equally at risk for sleep apnea. But more importantly, when the male is snoring, they have what we call as a spousal arousal syndrome. Like because of the noise there, they don't sleep well. And sometimes, like the male stops breathing and they are trying to wake up and push them so that they will start breathing. And subconsciously, they never go into deep sleep because they are worried that their spouse may stop breathing anytime. So all of these can also disturb their sleep and they feel tired during the daytime.
Absolutely. And doctor, I actually moved out of the room and I sleep in the guest room because I would tell my husband that you're snoring. Immediately I start getting a headache and then I seem to lose my ability to fall asleep after that. It can be quite troublesome.
Guess what? You will be surprised at the number of couples who do not sleep together, and that is related to snoring in one of the spouses. So I will move on to the third group, which I was telling you about the fragmented sleep. In men, I talked about prostate problem, which women won't have because they don't have a prostate. But the problem that happens often in women is what we call restless leg syndrome. So what happens is they go to bed, they have a creepy, crawly kind of feeling in their leg. They feel like shaking the leg. They feel like getting up and moving. They feel much better getting out of bed than lying still in bed. And that's what we call as a restless leg syndrome. And the diagnosis is purely clinical, just based on what they're telling me. Trust me, there are women who come saying that, it is so bad that I don't even want to see the bed because, like I'm so worried that it'll wake me up. I just can't go to bed. So it can be very severe, and it's known to be associated with anemia, iron deficiency anemia, which again is a lot more common in women than in men, related to the monthly menstrual periods and blood loss and stuff. So iron deficiency particularly has been shown to be associated with restless leg, and that's something we correct when they have. Pregnancy, particularly second trimester and more, is known to be associated with restless leg syndrome. And the good news is once they deliver, usually that comes back to normal. There are other conditions that are
I was just thinking, doctor, you said once they deliver, it comes back to normal. And I was going to say after that, they don't have luxury of sleep at
sleeping due to other reasons.
all.
Yeah, yeah, that's true. And the other common conditions are diabetes, which can be associated with restless leg, any kind of chronic pain syndrome. By that, I mean low backache, knee pain. Again, some of it is more common in women just with the posture and all that they adopt. So definitely those are known to be associated. Kidney diseases can be associated, but these are all, the underlying factors. But in general, restless leg syndrome is much more common in women. When they present with that, we do the blood tests or whatever is necessary to find out if they have any of these that is precipitating the restless leg, and then try to treat it. And like I do want to mention, because I know you are big on holistic therapy, guess what really works well for them? A nice warm bath in the evening and a nice massage of their legs, preferably by the spouse, but obviously not everybody gets it. But certainly the massage of the legs and a warm bath certainly seems to help a lot of people. I highly recommend that even before going for any medications.
I totally agree, doctor. And I think the biggest thing I took from all that you spoke till now was that you pointed out how at times the lack of sleep can be overlooked, and women go on this search between specialists for various other conditions. And I truly feel you've hit the nail on the head with that, because sleep is so foundational. So I really feel begin with that before you even go into self-diagnosing or the round of specialists to get other diagnosis. Always start with sleep. And I loved what you also shared about the bath, because I have a whole Abhyanga masterclass which is available all over on just how to do the right oiling and bath for yourself for better sleep.
See, and it's a real lifestyle related problem, and I must add that one of the other common reason why women sleep less or feel like sleep deprived is a lot of it is a cultural thing. They still believe in waiting till the son comes home and has his dinner, and it's still extremely common that they want to sleep after the husband sleeps. And there were days when they used to eat only after the husband eats, but I think that's coming down a little
No,
bit.
I don't think it's coming down, doctor. It's prevalent a lot. You're so right that maybe it's not seen in certain parts of the world, but it's definitely a major challenge in many parts of the world. I just want to ask on that note, do you counsel your patients and family on these aspects as well, as to prioritize themselves?
Totally. I mean, we have a counselor, it is just more to use the time better from me seeing the medical aspects. But of course, I do end up talking to them a little bit, because that kind of reinforces to them much more than just only a counselor talking to them. But we certainly talk about all of those. There are so many of them who sleep late. As I said, they have to complete all this work. Sometimes the son is working in a business process outsourcing center and comes home at midnight. She opens the door and then tries to come back to sleep. And then she hardly gets 4 or 5 hours of sleep and has to get up in the morning to kind of, pack breakfast, lunch, or, whatever for the family. So definitely they shrink their sleep time a lot and they think that they can cope with it. But unfortunately, as I mentioned earlier, the more sleep debt you accumulate, the more chronic problems you have. You feel chronically fatigued, and, the drudgery of household, or whatever, you just feel exhausted all the time, and that's something that they need to think about earlier and seek help. And when I say seek help, it is not always medication, as you appropriately pointed out, teaching them to change some of their lifestyle to cope with this better.
Are there any other aspects that you missed in terms of female specific?
These are the main ones that I would say, but I do want to reiterate that all sleep disorders are common in both sexes, but these are relatively more common in women than in men.
I would like us to talk a little more in detail, Doctor, about the menstrual, premenstrual, because you brought attention to that, and that's something you hear so much about, be it in any health forum. There's always somebody talking about cycle-related insomnia. Now, generally, what can we do? Because this is something that's happening all the time, and so what are the options that you would suggest?
I mean, I may sound old, but in the good old days, it was not uncommon practice for women during menstrual periods to be totally out of home. I'm not talking about any, cruel way of doing it, but, I'm just talking about taking rest. They were not involved in like cooking, or they were not involved in the day-to-day religious aspects, because they wouldn't enter the, puja room or the, religious room of the house. So, all of those gave them a lot of rest, and the rest seemed to help them cope well, with, sleeping better, and then get back to their routine after the few days of the menstruation. Today, I think, like on one hand, there's a lot of awareness being created about menstruation. There is much less inhibitions for both men and women to talk about menstruation. But I feel that it has gone to the extreme that even during the menstrual periods, when, like it or not, your body is exhausted, and people want to continue to do all that they were doing on non-menstrual days or during the non-premenstrual days. And I think it is not wrong to take a few days easy. I know that there are organizations beginning to consider, menstrual holidays and stuff, but I really think that we need that body's rest, mind's rest. I mean, I remember, the good old days, some of them used to sit and read a book outside or just listen to music. Where do you get that kind of a time? I think it's a lifestyle related sleep issue now that's getting worse.
You're right, doctor, because this has become a very touchy topic, and I myself, when I speak about this, I hear criticism from a lot of women that they can do everything, anybody can do. But I think you highlighted the difference between this is not something negative, but it's more a form of giving you rest. And I think that I would celebrate anybody who gives me few days off and says, go and lie down and do nothing much and just let your body recover. And I think there's a whole yogic aspect as well, that during menstruation, there's a downward energy called Appana Vayu, which is moving. And when we push our body to the gym during that time, or we push our body to do yoga, vigorous yoga, this energy reverses and it contributes to a lot of menstrual challenges. So I just wanted to share that for our listeners to understand that we're not coming from a third world mindset, but more that there's a deep science to why we need to probably down regulate and give ourselves the space to relax.
I almost would compare it to like a viral syndrome. Like by that, what I mean is like when you have a viral illness, what do you feel like doing? You feel like eating healthy, you want to have warm fluids, you want to take some rest, and painkillers as required. And that helps you to recover faster. And it's exactly the same. I'm not saying menstruation is a viral disease. I'm just comparing it because you need similar kind of lifestyle change during those few days for you to recoup well and get back to your routine.
Just like in a male specific sleep disorder, could you wrap up this episode with three top ways in which women can know when they should look out for further help, or how they can help themselves through prioritizing sleep and also supporting themselves in better sleep?
I just realized that I forgot one thing that I wanted to mention, and then I will wrap up with giving you a summary. We talked about parasomnias or, like something abnormal happening during sleep. And I talked about specifically REM behavioral disorders in men. Similarly, in women, sleep eating disorders are much more common than other parasomnias. They may get up and eat without their knowledge and then, get back to sleeping. They don't even realize that they have eaten.
I'm just wondering, why is that a very women specific? Is that something you've seen? Is it just
It is just more predominant. I don't think there is a reason for that. I'd like to wrap up by again, talking about what are the broad disorders that are more common in women. I talked about insomnia or lack of sleep, and there are a lot of social and lifestyle factors that lead to reduced sleep. We talked about, like caring for the family, trying to eat or sleep after everyone eats and sleeps, and then trying to wake up in the morning to catch with a lot of household work is an extremely common phenomenon in women that can lead to reduced sleep. In general, women require a little bit more sleep, like 20 minutes more sleep than men, but most people probably do not get it. And the symptoms of this could be daytime fatigue, lack of energy, and not feeling like doing anything. And I wanted to reiterate the fact that most people end up going to several specialists trying to look for a reason why they are chronically fatigued or have trouble, when in fact they should first be addressing their sleep issues to get better. And when I say sleep issues, not everybody needs sleep study or medications. A lot of them may just need to look at their sleep hygiene and improve that with counseling. The second thing I talked about is sleep problems are very common in women at all ages and at different stages. And we mentioned about, like menstruation during the premenstrual period and the menstrual period when they could have disturbed sleep. Also during menopause, where there's a lot of sleep disturbances, and pregnancy, which can be associated with both sleep disturbances and in particular leading on to the next one, what we call restless leg syndrome, which is a fragmented sleep pattern where they have significant creeping, crawling feeling in their legs, which is extremely uncomfortable and can disturb their sleep. It has been associated with other medical problems, particularly anemia, pregnancy, diabetes, chronic pain syndromes, and kidney diseases, which we need to rule out and get treated. I also briefly talked about the parasomnia, the sleep eating disorders are slightly more common in women than in men. So I would, if there's one thing I would say, I feel that women ignore their sleep problems more than men, and they manifest with so many other problems, and they think these are other medical problems. I think they should address sleep disorders first.
perfectly said, doctor? And I think I hear you come because we live in a world where there's social media forums and everybody is an expert everywhere. At times it can be alarming to see women making recommendations to women struggling with challenges in so many levels, and I think this has become a dangerous trend in itself. At times I've even come across people recommending sleeping medication to others and with no background, and I think this is a truly dangerous trend. And I'm glad you brought attention also to address sleep first, but I'll also say if there's serious sleep challenges and you do want to go down the route of medication, please do it under the guidance of a qualified expert. Even if you live in a country like India where some of these are over the counter.
I totally agree. Self-medication is the worst thing they can do.
Thank you, doctor. It was great to have another conversation with you, and you always have a wide approach and very subtle aspects, and I truly appreciate it.
Thank you very much.
In my Ancient Abhyanga masterclass, you can get frameworks to choose the right oil, massaging with the right energy meridians, and how to create your own bath powder. Buy yours at ohahealth.com/ancient Abhyanga master class/. If you need curated protocols and deep level understanding on rebalancing your whole body and sleep, I have fully guided practices to restore balance within my Healing Digestion course and Blissful Sleep course, which you can get at www.ohahealth.com. Have a great day.
This podcast is intended to provide helpful and informative material on the subject matter covered in the episodes. The podcast is not acting in the capacity of a doctor or a registered dietitian and is not rendering any professional healthcare or medical service. The information in the podcast is not intended as a substitute for medical advice or services or as treatment or cure for any particular health condition. The advice and tools contained herein may not be suitable for your situation. Any medical questions regarding contraindications and cautions, or any questions on whether or not to proceed with any practices provided in the show should be referred to qualified health professionals before adopting the same. The podcast specifically disclaims any responsibility for any liability, loss, risk, personal or otherwise, which may be incurred as a direct or indirect consequence of the use of information from this podcast or the application, adoption of any of the information provided.